Yes. So note down all the points. So I'll take you. You can fix the time. Whenever I'm giving the lecture, you can fix the time and you can write in the chat box which time is suitable for you tomorrow so that I can make it uh, here. Okay. So if anybody is interested, they can also join, no problem. Other than personal session, these are lectures. I'll give you specially for you people. So, for example, if Dr. Farhan, he wants to join, he can join anytime, no problem. He's a special student, so he can join any session of mine. Yeah, right. Okay. So Dominic D'Souza. Dominic D'Souza. So we are going to do this particular test now. Yes. So this is 9th December. 9th December, and this is Monday. Monday. Yeah. I'm going very fast, okay? Yes. Right. Dominic D'Souza. Listening part A, tips, tricks, and techniques. Now go through this for a minute. Go through this for a minute. I'm going to teach you these things. Try to understand what it is talking about. Now here, whenever you read this text, you should imagine three things here. First one is, okay, who is the medical professional? Now here, ophthalmologist is the medical professional. That means he is the authority. He is the right person to give proper information. And he is talking to whom? He is talking to a patient, and the patient's name is Dominic D'Souza. That we already know, right? And then that's very clear. Who is talking and to whom is he talking? What is the name of the patient? That's it. Other things are common. 12 questions will be there that we already know. It is the same for everything. 30 minutes is the preparation time, pre-listening time before the audio starts. 30 minutes will be there. So that 30 minutes for everything, it is the same. So that is not new for us. And the name of the patient, we already know there. So Dominic D'Souza. So this is also not important. So two things are important here. One is who is the medical professional and who is the patient and what is it is all about. This is all about eyes. That's it. ophthalmologist. We don't know his name. We don't know his name. So the specialist is ophthalmologist and the patient's name is Dominic Souza. These are the two important things. Plus the third one is, where are they? They are in the ophthalmologist's office. That means it is related to eyes. Eye related topic. That's you have to remember. Related to eyes. He has some problems with eyes. These are the three things you have to know. That is the beginning. That is the beginning. Before you listen, you have to know these three things. So the entire discussion will be rounding on this eye related problem. That's all. So problem, ophthalmologist, we know. Dominic D'Souza, we know. Now, what is more important than these two things is eye problem. So the entire topic is related to eye problem. So this is a topic related to eyes. Eye related consultation. Okay, related to eye. There is a problem with eyes. Okay, this is a consultation and the patient has eye problems. Consultation, okay, with an eye specialist. Consultation with an eye specialist. We know that one now. Okay, that is ophthalmologist. You should know. Then here the second point is the patient has eye related problems, eye related concerns. So that is the second thing. Okay, that means this is related to eyes. The topic is related to eyes. The topic is related to eyes. So you have to understand three things. The specialist is ophthalmologist, the patient has eye problems, and the topic is eyes, eye problems. Okay, eye problems or eye concerns. So this is the topic. You should remember from these two things, we derive at a conclusion that this topic is related to problems, eye problems. That is the main thing you have. This is the most important thing that you have to know. This is the way how you have to guess. If you do like this, you will get 42 out of 42 like this. Okay, you can get 9 bands in IELTS, or you can get 42 out of 42. That means 500 score in the OET. Right. So that's very clear. Right. Now coming to the point. Second one. Now we are moving into the main um, part. Main part. We are moving into the main part. What is that? Questions 1 to 12. We are jumping into questions 1 to 12. Right. So you have to come out with this point that there are, yes. Yes, there you are. Fine. That is done. Now we are going to the questions. Clear all drawings. Now go through these questions from 1 to 5. Go through these questions from 1 to 5. One lecture I'll give for the full listening test, so that next test you can do. Nilani, then Nishanti. So for you both, you can do the next test based on this knowledge. And Dr. Farhan, you also new, totally new. So you listen to all the full test today. Then afterwards, from tomorrow onwards, you can do listening on your own. I'm showing you how to do all the all the three parts I'm showing you now. Okay, right. Go through this for 2-3 minutes and just understand what it is all about. Yeah. Now, next point is you think about the words history of the condition, ophthalmologist, eyes related problem. That's it. He has worn glasses for 5 years. So now you should know what you should read and what you should not read. There is no problem here, so you need not read this one. There is no problem in these two, so don't need to read that one. Okay. There is no problem here in this, so need not read. So wherever blanks are there, focus on blanks only. Write down the notes. Okay. Dr. Farhan, make notes. Where there is a blank, there only you read. All others, no need to read. Why do you want to waste a time where there is no need? Okay, you don't need to attend all these things. So don't read everything. Now, symptoms first apparent in poor, poor vision, poor light, poor ambience, poor ambience, light, vision, okay, clarity, okay, something like that. The words will come here. A noun will come. You should guess here. A noun. A noun will come. It is symptoms first apparent in poor light, poor vision, okay, poor ambience. So like that you can guess the word. What will come here? It's very important that you guess the word. So the word before will help you. This is an adjective. This is an adjective. So this poor, okay, poor locations, poor vision, poor lighting, poor lighting, poor light, poor vision, poor ambience. So like that. Okay. So it may be anything like that. It may be anything like that. So who is this iPhone? Can you write your name there? iPhone, can you write your name there? I need to know your name, please. Right. So poor, some noun will come because poor is an adjective. Poor is an adjective. So some name will come here. Name. Noun will come. Some name. Okay. Name of the city. Some quality of that name. So lighting, maybe. So the words which may be there are light. Okay. Small letters, no capital letters. Or it may be vision. Or it may be lighting, or it may be ambience. So like that, there may be some word which is closely related to this. So that you have to understand. Okay. Right. So that may be the one of the answer, or anything else may be the answer. Right. Yes, iPhone, did you type your name? Please type your name. The next one, don't may ask me again and again, please. Next one, number 2, has recently stopped working as a. A. A is an article. That means the next word is a noun. The next word is a noun. So here, a doctor, a engineer will not come because a doctor, a teacher, an engineer, an officer, an electrician, but a doctor. So you should know, you should understand like that. Doctor, a mechanic, a mechanic. So you should guess the words. What may be the words? You should guess in your mind. What is there on your mind? I am typing here. A doctor, a mechanic, a nurse, a teacher. So these will be suit. An officer will not come. Officer will not come. Electrician will not come. Engineer will not come. Okay. So driver, a driver. Then a plural will not come. Drivers, doctors, mechanics, nurses, teachers will not come because a is there. Singular or plural. Singular or plural. You have to guess. You have to guess like that. Otherwise, you'll make a mistake if you don't see A and you'll write doctors. It is wrong, because he may tell you like this: I am one of the doctors. I am one of the doctors. I am one of the doctors. So you will hear the word doctors, but it is wrong. He cannot be doctors, right? He is one of the doctors, means one doctor. So it means, though you hear doctors, you have to write a doctor only. Remember that. Oh, I don't understand. First, second. Yeah, iPhone. Can you unmute, please? What is your name? What is your name? What is your name, please? iPhone. Either you type your name or you tell me your name. Yes, thank you. Jacqueline. Yeah, very good. Thank you. I need to know the name, right? I should know whether you are regular student or not. So you are invited for 1-2 days demo session, no problem. Okay. You can attend the session. Rename Jacqueline. Okay. Guest. So fine. Right. Thank you very much. So you have given me your name. That was really good. Okay. Right. No problem. So here, a driver, teacher, mechanic, nurse, plumber. So like that, there may be any name, but it will not be plural. It will not be like the vowels starting with the sound of the words starting with the vowel sounds, like engineer, okay, examiner, or officer, electrician. Okay, such words will not come here because A is there, not an. So the word before will help you identify what is the right answer. What is the right answer? You can guess. You cannot get the correct answer, but you can guess what type of answer it is. Number three. Number three. So the word A is going to help you here. The word A is going to help you here. Okay. Yeah. The word A is going to help you. It is telling that the next word is a noun and it will be singular. It will be singular, and you cannot use a vowel initiating sound letter, a word which has a vowel sound. You cannot use that one. So it is telling so many things. Right. Now, number three, possible dash observed in the left eye. Possible dash observe. So possible some condition, medical condition, some problem, something was noticed. Something was noticed. Maybe redness, some condition, some symptom, some sign, some situation, or some problem was observed, was noticed, was found, was discovered in the left eye. In the left eye, not in the right eye, in the left eye. So right eye has some other problem maybe. So we're talking now about the left eye. We're talking now about the left eye. What may be the possible things? If you want, you can write there. No problem in the chat box. Otherwise, just listen. So possible dash observed in the left eye. Something, possible something observed. Something observed in the left. Something. That means it's a noun. Some things or something. Maybe cataract. Okay. Maybe redness. Maybe swelling. Okay. Maybe swelling. Maybe liquid, fluid. Okay. Or sticky fluid. Or pus, maybe. So let us take all these words. So possible, you can say redness or swelling or pus or infection. So something like that. So you should guess what might be there. And if you guess, it will be easy for you. So you will know what type of the word will come here. Increased intake of something recommended. Intake of some. That means it's consumable. It is intake. Maybe eating item or a drinking item. It may be food item or it may be drinking item. Maybe intake of fluids. Maybe fluids or fiber intake of vitamin K, maybe vitamin D, maybe vitamin A, maybe, or fluids, maybe fluids, or maybe fluids, fiber, maybe, or intake of fibers, maybe, or green leafy vegetables, okay, vegetables, maybe, or fruits, maybe, or maybe um, what else? So it may be fluids, fibers, vegetables, or what may be there? Um, Increased consumption of water, maybe. So, or you can say proteins, maybe. Proteins, maybe. So it may be anything like this. Okay. It may be anything like this. So he's asking you to guess what may be there. Yeah. So, right. So it may be fluids, fibers, vegetables, fruit, water, proteins. What it might be. So increased intake of something. Okay, to better the condition of the eye, he has to take maybe vitamin K, vitamin A, or vitamin tablets, or proteins, or fibers, or liquids, or fruits, or vegetables, whatever. Okay, it may be something like that. Dash suspected. What is suspected? Something is suspected. Maybe what it is? Maybe infection, or maybe viral infection, or virus, okay, or fungal infection, fungus, or pus, okay, or maybe any other thing, maybe. So you can say glaucoma, maybe, okay, glaucoma. What is so found there? So it may be anything there, okay. What may be guessed here? So like that, infection, or virus, or fungus, or pus, or glaucoma, or something, or whatever it is, you have to guess like this. So in this 30 seconds, you'll be guessing these words fast, fast, fast. Now it will take time because I'm explaining you. But if I do, I will finish it in 15 seconds. So you can at least try in 30 seconds. Okay, right. This is added time for you to understand the question. This is how you will guess the words and you will be mentally ready. But before the audio starts, a beep sound, you will guess these words. That is very important. This is how you have to find out. So, next. Yeah. Now we are going to the next question from 6 to 12. Let me, yeah, post this full screen. Yeah. Yes. Now, next one. Next one is here. Yeah, 6 to 12. 6 to 12. Now go through this for 1 minute. I'll explain afterwards. You guess what will come here, what will come here, what will come here. You guess. So today I will be taking lot of sessions. Anybody is available, attend, because I am going to give a lot of preparation for Dr. Farhan, and whoever is available, he is fully available today. It's the first day. So like that. So now Nishanti and Nilani said we are available today. So I arranged. So like that, many sessions I'm going to give. Whenever you are available, you can join and you can attend. Okay, first 2 days, if you don't do test also, no problem. Today you do attend my sessions only. And if possible, you can yeah, attend the reading also, because after this I'll give reading. I'll give reading. One lecture, full lecture I'll give for reading. I'll complete this book as far as possible. Yeah, can I join for nursing OET? You want to join for the course, you mean? Jacqueline. Yeah, this is for regular student. Today you have demo session. This is a demo session. Okay, doctors are there, nurses are there. Okay. But discount is over. There is no discount now. But if you attend it till the end of the session, okay, whether I will decide whether I will give you admission or not. I'll give only admission to those students who are very serious. So, Jacqueline, if you want to attend the session, you attend till the ending until I stop the audio video. You attend. Then you ask me the link. I'll give you the link. Then you can message me. Then I will think about giving admission. I want only serious students to attend the sessions. Okay, if you are paying the fees also, I will not give admissions. Okay, I don't mind money. I want students who will give good results. So you are there till the end of the session. I stop the video maybe after 1 hour or 2 hours or 3 hours or 4 hours. When I close the session, till that time you are there, then I'll give you admission. Otherwise, no. Right, because I want a dedicated students, hardworking students. See, Dr. Farhan, he is a doctor, medicine student, but I'm taking with him. I'm giving a lecture for nurses now. But I told you, wait, I'm giving for them, but no problem. You also wait. He said, okay, sir, I'll wait. That's it. He's good. Tomorrow I have to give him this lecture. So today only he's attending. It's good. Tomorrow he will save his time. Tomorrow he can go directly for the test. When reading and listening together, he can go like that. It will benefit him. So he's very obedient. He's listening to me. So I'm giving him. If he says, no, sir, I cannot attend, I'll say, okay. So tomorrow he will attend. So who is going to lose? I'm not going to lose anything. So he's also not going to lose anything. But he will lose the time now. Tomorrow he'll take the test. But if he attends today, he'll be benefited. Everyone will be benefited. If you're obedient like that, a doctor or like these nurses, if you are obedient to me and if you're paying attention, I'm going to give you everything. Yeah. Now coming to the point, here it is. Yes. Uh, now, the question. Now here presenting symptoms, signs and symptoms. Now we have the left eye and then the right eye. We have two eyes. The left eye is here. Okay. Now we are going to the left eye. Problems at judging dash of objects. The word is off, OF, off. Off is a preposition. Preposition joins two nouns. Preposition joins two nouns. A pen in my pocket. A pen in my pocket. So a pen is a noun. Pocket is another noun. What is in what? A pen in my pocket. So something of objects. So noun of nouns. Objects is noun. So something of objects. What is that? Judging the distance of objects, maybe the distance. So it's an adjective here. Noun but adjective, quality. Okay, it's a noun only, but name of that quality is a distance. 6 kilometers, 5 kilometers, 5 meters, like that one. Okay, it may be the distance. Judging the distance, maybe judging the size, maybe judging the color, maybe judging the shape, maybe judging the height, maybe judging the height, maybe judging the length, maybe okay, judging the breadth, maybe okay, judging the appearance, maybe or look, maybe coarse, rough, smooth, soft. So distance, size, color, shape, height, uh, size, shape, color, quality, quantity, anything, maybe quality of the objects, maybe color of the objects, maybe color. I give it. So it may be judging the quality of some objects. Okay, distance, size, color, shape. Okay, what color it is. So color of objects, judging the color of the objects. Maybe if I am color blind, I cannot see all the colors. Maybe I'm short sighted. I cannot see things which are close. I cannot judge them how far they are from me, like that. So it's far sightedness. So this is sight. Okay, we don't know how much far it is, like that one. So central vision is. So left eye, central vision has a problem. What is that problem? Maybe central vision is not clear, maybe blurred, not clear, not clear or imperfect. imperfect, or problematic, or blurred. Okay, central vision, or it may be confusing, or not clear, or imperfect, or problematic. It may be some word like this one. You have to understand what exactly it is all about. So, not clear, or imperfect, or problematic, or blurred, or whatever it is. Okay, or short sighted, or long sighted, or any such medical condition, maybe. Dash vision unaffected. Central vision already we have seen. Central vision already we have seen. Now this may be circumference vision. Central vision, okay, general vision, general, overall. Okay, dash vision is unaffected. The central vision is already have some problem, you can see in question number 7. So central means the central vision in the center part of the eye. Central vision. So peripheral, or surrounding, or borderline, or what do you call, circumference. Okay, central, central, peripheral, central, borderline, central, circumference, central, um, many other words which we can use like that. There are many other words which we can use. So this is peripheral vision, or borderline vision. Borderline. See, for example, vision. This is our area of vision. Central vision means for example, you are there standing and I'm looking at you. Central vision. You are very clear. I can see you very clear. Okay. But outside area, the border, this corner, this corner, that corner is not clear, because I'm focusing on the center. But central vision is a problem. It's blurred. Central vision is blurred, maybe. Central vision is not clear, maybe. But peripheral vision is unaffected. That means outside area, everything I'm able to see. But central only I'm not able to see properly. Central vision, I cannot see you properly. You're standing in front of me. That central vision is blurred, confusing, unclear, problematic, imperfect. That's why I'm not able to see you, though you are in the center of my vision. But peripheral vision is unaffected. It's perfect, perfect, or borderline vision, or circumferential, or borders vision, border vision is perfect. So what word will come, that you have to see. This is central vision. Central is an adjective. So here also dash vision. Here also it's an adjective. So it may be like border vision, or circumferential vision. Okay, or borderline vision, or you can say peripheral, or you can say what else, border, peripheral, then outer ring, outer ring, we can say ring road, outer ring. Okay, circumference, we can say circumference. So all these words you can use. Next one, has stopped the dash. Has stopped the dash. He stopped something. He stopped something. What did he stop? Maybe his vision is not correct. That's why general vision is not correct, because his central vision is blurred. So he stopped something. What he stopped? Maybe walking alone. Maybe he stopped. Maybe driving. Maybe he stopped running, or walking, or mobilizing, or ambulating. He stopped walking maybe alone. He stopped walking alone maybe. He stopped ambulation maybe. Somebody has to take him. Or he stopped mobilization maybe. Okay. Or he stopped driving maybe. Okay. He stopped driving maybe. So you need vision, proper vision to drive. You need proper vision to walk. You need proper vision to ambulate. You need proper vision to mobilize from one place to another place. So his view, vision is blurred. Central vision is blurred. If something vehicle is coming, he cannot see properly. So then what he will do? So maybe driving. Okay, right? That's another problem. So next one, asked for clarification regarding dash to be administered. Asked for clarification regarding dash to administered. So what should be administered here? What should be administered? Maybe eye drops, maybe. eye drops maybe, maybe medication, maybe medication to be administered, or maybe gel, eye gel, maybe gel, right? Or maybe something else. Okay, cream or lotion or eye drops or some powder or anything like that. So, yes, it may be anything like that. So, he asked clarification. Why should I use this one or what that one? So, he has asked for clarification regarding eye drops, maybe medication, maybe gel, maybe tablets, maybe or injections maybe or anything like that. So clarification. So what is to be administered for that one? He asked why this one like that. He's asking questions to test for suspected leaking. What do you mean by leaking? Leaking fluid will be leaking. So fluid will be leaking eyeball maybe leaking in the eyeball. There may be nerves. So leaking nerve maybe or leaking arteries maybe, leaking blood vessels maybe, leaking veins maybe. So only a pipe or a pipe-like thing will leak. A pipe or pipe-like thing or a container which has some fluid will leak. Mostly, that is what it is. So what will leak? Maybe blood will leak from the blood arteries because there is some damage maybe. That's why that redness in the eye maybe or pus. Okay, pus or nerves. Okay, nerve inside nerve there may be some fluid that will maybe leaking maybe or maybe some blood vessels may be leaking, veins may be leaking, arteries may be leaking or any other such vessel which is carrying some fluid may be leaking. Okay, right. May be leaking with something. So what are those? Maybe arteries. To suspect for suspected leaking arteries, maybe veins, maybe it may be plural. So to test for suspected leaking, a leaking artery, a is not there, so it may be plural. Okay, maybe singular also, we don't know. So it may be like, yeah, I'm writing here. Here I'm writing. It may be arteries or artery, or it may be veins, or it may be blood vessels, or blood vessel, or blood vessels, or nerves, or something else, or something else. So it may be anything of that sort. Okay, arteries, veins, blood vessels, nerves, leaking like that, leaking. Okay, right? And yeah, this is a very special lecture. Okay, I'm giving for everyone, so attend. Okay, this is an extra session other than your sessions. This is extra session, so I'm giving a full lecture for listening. Okay, because of some new admissions and because of the students who cannot attend regularly, I'm giving these sessions. All of you participate. Okay, and then next one, 12th question. Expressed concern about possible need for a dash. Expressed concern about possible need for a dash. It may be possible need for any intervention, for medical intervention, maybe. Okay. It may be for medical intervention. Medical intervention. Okay. Maybe, for example, it may be a surgery. It may be a surgery, or it may be uh, for repair, or it may be replacement, or it may be, okay, concerned about possible need for management or something else. Okay, something else. Need for medication, maybe. Okay, anything. It may be anything, but you have to guess what may be possible here. Okay, treatment already is done, so medication is done there. So this may be something more than medication. Okay, more than medication. He's concerned. So his surgery may be most likely surgery or operation, maybe surgery or operation. Listen for such words. Listen for such words. Now I'm going to play this. I'm going to play this. Nilani and the other girl. Okay. Sorry, I don't remember names mostly. So, uh, Nilani and okay, fine, no problem. If I don't remember your name, no problem. It doesn't matter, but you understand. So, uh, I'm sorry for that. Poor man, 54 years old. So, I am going to complete this part A, then part B, then part C. If you want to extend your time, whatever you want to do, you do. Otherwise, I have posted on the YouTube. Afterwards, you can listen to that. But attend this session because I am doing this for you people, both of you and Dr. Farhan. Okay. Let me take any length, no problem, because tomorrow you can relax. I also can relax. Okay. Right. What's that? So in your personal session, you can ask doubts related to these things. So how to do this? Some other things you can ask because I'm focusing on these things. You can ask something else. Yeah. Hide mode. Yes. So now I'm going to play the audio and you have to be ready and you have to do this test and try to get 12 out of 12. Write individual letters. Don't write cursing letters. Every letter should be very clear. Every letter should be very clear. A should look like A, B, C, D. If it is not understood, if a second class, if a UKG boy cannot read your letters, that means your answer is wrong. No doubt regarding that. Yeah, no doubt regarding that. Hide. Okay. Right. I'm going to play this one. Right. Yes. So this audio I'm going to play now. And here is the text. This is the PDF. Right. Get ready. Write down one, two, three, four, five, six, one below the other, one below the other. And write every individual letter clearly. Otherwise, write side and afterwards rewrite neatly. Okay. Write in a side and afterwards write neatly. But every letter should be very clear and neat. Don't write running handwriting. Don't write cursive handwriting. A should look like A. B should look like B. C should look like C. Be very careful. UKG boy in the kindergarten, not even grade 1. If he can read your letters, for example, you write there glaucoma. He should be able to read. He doesn't know what is glaucoma. He doesn't know the word. So he will not read the word, but he should read the letters, identify the letters. If he does not identify any of your letters, that means your answer is wrong. Mind you, it will blow your mark. Be careful. Afterwards, don't tell me why you lost your exam. Because of this nonsense, many people are losing their marks. And they don't even know why they are losing these marks. It should be, he should read it like this: G L A U C O M A. If you cannot read these letters like this, you lost the mark. That's it. LKG boy who knows ABCD should be able to read the letters. That's all. Forget about your word, forget glaucoma, forget about anything else. If that he reads, your answer is right. Remember that. Okay. Now, I'm going to play the audio. Yes, here is the full screen. Yeah. Yes. Write in your notebook. Yeah, write in your notebook. Afterwards, you are going to submit your papers to me. Then I will tell you whether it is right or wrong, because you don't know how to correct it properly. I will correct your paper. So after finishing this, you have to send it to me, so that in the exam you will not lose any marks. You have to send. So write it very neatly. I'll say it is wrong. I will talk like a UKG boy only, and I'll tell you it is wrong. That's it. So be careful. You are going to lose your mark if you are not careful.
My eyes. I started
Can you
getting
hear?
short-sighted about 5 years ago, soon after I retired. So I had to get glasses.
Questions 1 to 12.
Can you hear
Here's an
now?
ophthalmologist talking to a patient called Dominic de Souza.
Yes, fine, thank you.
For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Mr. De Souza. I've got your notes here, but I wonder if you could tell me in your own words when you first had problems with your eyes, how the condition developed, what treatment you've had, and anything else you think I should know.
Yes, of course. Well, I've got the usual age-related problems with my eyes. I started getting short-sighted about 5 years ago, soon after I retired. So I had to get glasses for that. But with this latest problem, I realized that my eyes had got much worse quite suddenly. What happened was I was walking home at dusk one evening. It was getting dark and there wasn't much light, and I suddenly realized that I was struggling to see where I was going. And that wasn't all. I noticed I could see much better out of my right eye than I could out of my left. It was all a bit worrying.
Yes,
I mean, this was quite recently. But after that, my eyesight got worse fairly rapidly. I mean, I was doing some volunteer work for a charity, but I've had to give that up. Well, for the time being, at least.
I see. And you've been to see a local optician?
Yes, I didn't know what else to do. He did some tests and then said he thought he could see what he called drusen at the back of my left eye.
Right.
So he referred me here for further investigation. But he did suggest in the meantime that I should take a preparation that's high in lutein.
Mm-hmm.
He also said I should up my levels of green vegetables. Well, that's sensible anyway, so I've done that.
Good.
I was quite worried after that visit, as when I looked online at what he said, it seemed to suggest I'd got macular degeneration. So that was really frightening.
Hmm. Well, your optician was right to refer you. And from what you've described, that is a possible diagnosis. But we need to do more tests to see if that is the case or not. So, what's the situation now?
Well, I can't see very well using my left eye. Something's definitely wrong there. Like, I find it hard to estimate size. Things look smaller with my left eye than they do with my right.
Right.
But apart from that, the area right in the middle is blurred. It's all quite unnerving.
I can imagine. And how's your general vision?
Well, let's think. The optician said that I had no problems with my peripheral vision, and there's been no change in that as far as I can tell.
Right.
Yeah, and I'm still coping day to day. I mean, I can still manage things like watching TV, which I'm grateful for. But I recently decided I should give up night driving. I just felt my vision wasn't good enough anymore. Actually, I read in the leaflet you sent me that you might want to carry out an angiogram. Is that one of the tests you're thinking of?
One of them, yes.
Could you tell me a bit more about that, please?
Well, it's quite a specialist test. What it would do is allow us to see the back of your eye. And the reason for doing this is to establish whether perhaps your problems are being caused by a blood vessel there, which may be leaking. And it could be that which is affecting your vision.
See. Oh, another thing I read about is laser surgery. Is that the treatment for that condition? Because I'd be really worried about having that.
Well, we need to do the test first. And anyway, even if that is the cause, this condition can settle by itself. If it doesn't, there are various treatments we can offer. Yes, laser surgery is a possibility, but we're not at that point yet.
I see.
So we'll do the test. But what I'd like to suggest in the meantime are a few things you can do to help your situation.
Extract 2, questions 13 to 24.
So now we have completed the test. We have completed the test. Okay, we have completed the test. Remove pin. Yes. Right. We have completed the test now. Now what you do is, I'm going to give you the answers. You check your answers, but be very careful. I'll question you why you gave right answer if it is wrong. Okay, you have to treat that paper is your enemy's paper, not your paper. Don't do any favors. Think that it is my paper and I am your enemy, the worst enemy in your life. Like that you correct a paper. If you want to win the exam, let me check. Yes. I'm checking on you, Jacqueline, whether you are there or not. Yeah, because you requested me. I'm checking on you. So I have only 2 places. I don't know who will take today because today is the first day of the course. So now here you have to check your paper like that is my paper and I am your worst enemy of your life. That you have to correct. But you have to be genuine. You have to be genuine. Okay? You should not do any cheating. You should not do any fraud. Wantedly, you should not give wrong mark. Wantedly, you should not give right mark. You should give the mark which is a genuine. Remember that. Genuine mark. Okay, fine. I'm going to show you the answers. Keep the question paper in front of you. Take a pen, not a pencil. Take a pen and correct. Writing with pencil, but correction with pen. Okay, because I want to see it as standard. Yes, here we go. Yeah. Yes. Now you can see here. The first answer is light. The first answer is light. Or I'll give you the next shot. Wait. Yes. Now here, the 12 questions answers are here. Yeah. Yes, here are the 12 answers. Here are the 12 answers. Okay. Here are the 12 answers. Evening, if you don't write, no problem. Light is there, then it's okay. A charity, not there, no problem. Volunteer is there, okay. Then the sixth one, the is not there, no problem. The other words should be as they are without any spelling error. No capital letter. Capital letter should not be there. These are bullet points. So capital letters must not be there. Come on, correct your paper. And once you finish, take a neat photo and send it to me on WhatsApp. And for new students, I'll give you my WhatsApp link. No problem if you don't have. You correct it. Yeah. So I'll give you my contact details here. Yeah. This is my contact copy link. Yes. This is my contact. You can message, you can take the picture and send it to me there. Yes. So this is how yes. Fine. So now tell me how many marks you got. Your marks. Marks. How many scored out of 12? Yeah, Nishanti has sent the paper. Very good. Safurato has sent the paper. Yeah. So Nishanti. Nishanti. Yeah, light correct. Volunteer correct. Drusen correct. Then green vegetables. Your A is not very clear. Macular degeneration correct. Size correct. Blurred. RR not very clear, but mark you will get. Peripheral. Your R is a confusion. Night driving, you'll get mark. Angiogram, A is not clear. Blood vessel, laser surgery, very good. How many marks you got? You write down there, no problem. Right. Next one, Safuratu. Safuratu sent. Safuratu sent. Yes, light. Volunteer, drusen, green vegetables, macular degeneration, size, blood, peripheral, night driving, blood vessel, laser surgery. Okay. That is Safuratu. Very good. Nishanti. Nishanti, I did not check yours. I checked Safuratu's paper. Your paper is not very clear, my dear. Nishanti. Your paper is blurred. I cannot read anything. I'm sorry for that. You have to send again your photo. Nilani. Nilani. Yeah. Dark light. Light is important. Dark is not there. So dark is wrong. You cannot add a word which is not there. Okay. Evening light or light. That's all. Dark is not there. So you should not. So next one. Green vegetables. Right. That's right. Then blurred. Right. Your R, you have to be careful. Peripheral. Your peripheral. P is looking like capital D. P is looking like a capital D. So you have to be very careful. Next one, blurred, peripheral, you will not get the mark because it's looking like D. So I'll show you. I'll show you, wait. Yeah. Share it in. Yeah, I'm going to show you. Everyone will learn. Nah? Everyone will learn. Yeah. Yes, this is Nishanti's letter. Correction. Okay. Yeah. Here it is. You can see there. It is looking like a D. It is looking like a D. You lose this mark, my dear. You will lose this mark. Okay. Yeah. I don't want to hear anything, Safuratu. You have to change and you have to give. If it is dusk, put on the light and do something. Okay. But light is there, no? Right? So D should be small. This is should be P. Okay. Then this R is not clear. So you lose that mark for this one. Green vegetables. Okay. T. Line should be there. Okay. Light. Dot should be there. Dark is not right. Then next one, night driving, right? Angiogram. What is this, Nishanti? This is wrong answer. Angiogram. A-N-G. Okay. I dot. Okay, fine. No problem. I only, na? Okay. A-N-G-I-O-G-R-A-M. Angiogram. I should be dot clear. Okay, today excuse. Laser, not lesser. Laser. Then next one, spelling mistake. Okay. So fine. Night driving. Yeah, your R and V and I all look same like anything. I don't know. All D, R, I, V all look same. So be careful with your spelling. Okay. That's a problem. Next one. Next one is Safuratu. Safuratu, it's okay. That's not a problem. Your photo is fine. Okay. Share. Yeah, Safuratu. Yes. Where is this? Yeah. So Safuratu. Yeah. Light. Volunteer. Drusen. Green vegetables. A is not clear. Macular degeneration. Okay. Size. Blood. R little clearly you have to write. Peripheral. Night driving. Angiogram. A is not clear. Blood vessels. Blood vessel. Correct. Laser surgery. Right. Okay. Fine. That's fine. No problem. Next is. Next is. Yes. So Krishna. Krishna's handwriting is awesome. I love this guy. He writes very neatly. Okay. I like him very much for his handwriting. Share. Yeah, you see, your handwriting should be like this. Yeah. So this is, yeah. So you see how wonderfully he writes. Okay. Drew Sen. Okay. Green vegetables, macular. I don't have to worry about his handwriting. I don't have to bother because every letter is very clear. Okay. Even before, he did not need me to tell him that his handwriting should be improved. But many people I tell, but his handwriting, I don't have any problem. See how nice it is. Okay. So like this, you have to present everyone. Then you will definitely pass. Otherwise, you will lose the mark. Even if it is right also, it will be confused. So they will not give you the mark. Yeah, that's right. So how many marks you got here? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. No doubt regarding that. Drew Sen. You don't know the spelling. So write 10 times and learn the spelling. Light is missing. Okay, fine. Yeah. Today you got 10. Tomorrow you'll get 11. Day after tomorrow you'll get 12. That's awesome. Really, very good. Next. Yes, Syed Farhan. Share. Yeah. So tomorrow onwards, you don't need to worry. Tomorrow onwards, every day you can do your test on your own. You don't need my support. Yeah. So this is Syed Farhan, 10 out of 12. Lighting. Lighting. It's not lighting, it's light. It's light. What is there in the question? That only. What you hear, that only. You can hear only light. You did not hear lighting. So it is wrong. Lighting is actually correct in general. But what you heard, that only you write. He did not say ing. Then why did you write ing? That's the point. What you hear, that only you should write. You cannot do any modifications. So that is lighting. No, light. Light. This is wrong. This is wrong. Volunteer, right. Then Drusen. Green vegetables, right? Macular degestion. Your handwriting is very right. Nice. Size. This is Z. Right? Normal Z. Okay. This is fourth Z. Cursive writing Z. Don't write that Z. Write normal Z. Okay. Blurred. Right? Your R is not clear. Your R. It should be very clear. Okay. Peripheral. Right? Night driving. Right? Treatment. Okay. Blood vessel. Right? Laser surgery. Right? You got 12 out of 12. 10 out of 12. Okay. Treatment is one mistake. Then Drusen is another mistake. And lighting is another mistake. So you got 9 out of 12. Dr. Farhan, you got 9 out of 12. Very good. Very good. So you're doing well, all of you. Then next one. Next one. Jacqueline. Jacqueline's handwriting is also almost excellent, but not perfect. Still confusion is there. Yeah. Yes. The next one is Jacqueline. Yeah. What's this? Yeah, this is Jacqueline's letter. L. L should not be capital letter. This looks like L, capital letter. You are not supposed to write capital letters. So small letter will be straight line from top to bottom. Okay, slightly okay, but not this much. Okay, it looks like capital L. You cannot write capital L. Then next one, E is not very clear. You have to write a round I. Clear only, 90% it is clear. Drop set, your R. R is not very clear. R should be little. Right, learn carefully. S is capital, E is small. Why? All should be same height. Okay, otherwise they'll think that this is capital letter. Green vegetables. Okay, VEGETABL. B and L looks like L and D for me. Why should I think it is B and L? I can think L and D. So be careful. Why are you joining this both? Why are you confusing me? Or it may be LOL. My wish. However I want to read, I will read. There is no excuse. Macular degeneration, signs, size. Okay. Blurred. Don't join L and U. It looks like W. It looks like W. Be careful. L and U becomes W. Don't join any letter. Okay. Peripheral. Night driving. Okay. This R is okay. Little this up a little. Laser test. Why T is flying in the sky? Huh? Why it is flying in the sky? T. Huh? Angiogram. Okay. So laser test, no laser surgery. Okay, fine. That's fine. So good. Your handwriting is better. Okay, but not the best. Next one. Swapna Godugu. Yeah. So this is Swapna Godugu's. No, this is, yeah. So light. Okay, volunteer. Why are you joining O and L? It looks like A and L. Why are you joining? Write separately, na? And don't write this ring sign. Only one line you draw from top to bottom. That's enough. Just like T without a line, same like that L. That's enough. This, why are you making it a circle like oval? Then next one, green vegetables. Yeah, fine. Then macular degeneration. Y and A and T joined. T and I joined. T and I look like H. H. It looks like H for me. Why should I think that it is T and I? I don't want to think. I'm an LKG boy. I'll cut your mark. That's it. Blurred. Take it very seriously. Peripheral. A. What is this? Why you joined these two things? No confusion. Night driving. Why space here? Night. Why space in between G and H? Why space? Huh? It will be considered a mistake. Angiogram. Blood vessel. Laser surgery. Okay, fine. You can correct your paper and that's fine. Now finished. So you understood how part A should be done. Okay. Are you happy with the explanation? Can we go for the next? It will be very fast because we don't need to explain too much now. Yeah. So shall we move to the second? Say yes. That is Tony Fitzgerald. Tony Fitzgerald. Nishanti and what is the other girl's name? No, other girl's name I forgot. Nilani. Nishanti and Nilani. Yeah. Nishanti and Nilani. Nishanti, you said it is not your paper. Nishanti. Nishanti, your paper is very blurred, I told you. I cannot see it. I cannot read it. Okay, I'll show you. I cannot read anything. Okay. See? Why this hand? Why this camera? I cannot read anything. Can you read anything here? Huh? Can you read anything? No. I cannot see anything. Nothing. Zero. I can only see some shades. So when you're taking a picture and photo, do it very nicely, please. Okay. Right. Now, next. So we are moving to the next question. Okay. Yes, Tony Fitzgerald. Get ready. Tony Fitzgerald. This is 9th. Actually, you people missed yesterday's session. For them, I am taking this one. Otherwise, I have told this one yesterday itself. Yeah, but still you can try, because every time my lecture will be totally different, not the same. So listening part A, tips, tricks and techniques. Yes. Now here it is. Go through this point for 1 minute. Yeah, 1 minute. Go through that one so that you'll get an idea. Yeah. So extract 2. Extract 2. So you hear a neurologist. So the person, the medical professional is a neurologist. The medical professional is a neurologist. The medical professional is a neurologist. Okay. The medical professional is a neurologist. Right. And he's talking to the father. That means parent or caregiver. And he's the father of a 9-year-old boy. 9-year-old boy. And his name is Tony. His name is Tony. Okay. And he has recently started having seizures. Seizures. The problem is seizures. So neurologist, 9-year-old boy, Tony, seizures. That's all. 9-year-old boy, Tony, seizures. Remember that. Okay. Remember that. Okay. All right. A neurologist talking to the father of a 9-year-old boy, Tony, who has recently started having seizures. Important. Nothing else important. Seizures. Important. Neurologist, we know neurologist. That means he's talking about nerves. Neurons. Okay. Something related to brain. Nerves. Neurons. Neurology. Neurologist. Patient has problems related to these things. And he's 9-year-old boy. He cannot understand. So father is talking. And the name of the boy is Tony. The father is talking. Yeah. So that's it. Nothing else is important. Only to know that this subject is related to nerves, neurons, brain, and all these things. You have to know. That's all. And he's a small boy, 9-year-old boy. That's why father is there. That's all. Others, no need. Only the important point, the main part. These three things only we'll see. Neurologist, Tony, seizures. Most important is seizures. The subject is seizures. Remember that. Subject is seizures. Now, this is the point. Right. Now, we are going to the second slide. Print a screen. Only seizures is important. Other than that, nothing is important. Yeah, here it is. I'm giving you 1 minute. Go through it. I'm going through. Go through it. 1 minute, because we'll discuss. Fast, we'll discuss now. I'll just tell and write. That's all. And remember, all of you, whenever I am there on the video here, you are going to learn some things. Okay, put in your brain, when you have your own time, you do whatever you want. You do one reading test, you do one listening test, you do one writing test, you do speaking practice, you do anything, you do vocabulary, grammar, do anything. But when Simon sir is there on the video, be there. That's a blessing for you. Remember that. That's my blessing for you. Okay, the more you spend time with me, the more will go into your brain. Don't give limited time to me. Be generous in your time, because I'm generous in subject. I'm giving you more time. I'm giving you a lot of information. So I'm generous to you. I don't need to give this much, but I'm giving you because I want you to clear the OET with flying colors. So whenever I'm there, that is your wish. I'm not forcing you to come and join and spend more time with me. I will be there for you. As much, don't blame me, sir is taking too long lessons, sir is teaching too much. Don't blame me. How much is your pocket? That much only you fill. When somebody is showering money, you'll bring a big bag. Why? To put all the money in that one. But when somebody is teaching, also come with a big bag, as much as possible, within your limit. No force. But the more you sit with me, the more you learn. Remember that. First of all, I only don't give admissions also much. So whenever I give admissions, learn regularly. If you don't have time, tell me what time you are available, I'll arrange. Yeah. Now, described by pediatrician as. So what is not important? Don't read everything. Don't read everything. This is nonsense. Reading everything is nonsense. Seizures have started 6 weeks ago. No need. Because there is no question. He is unable to respond. No need. Because there is no question there. Lasted up to 2 minutes. No need. No need. No question there. Limited recall of event. No need. Is tired afterwards. No need. Wherever blank is there, focus on that one only. Why do you want to read everything and waste your time? Instead, focus that time on something else which is more important. See, if you read all these sentences, there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 sentences. But how many questions are there? 13, 14, 15, 16, 17, 5 questions. So for 5 questions, you should read 10 sentences, no need. So that another sentence time you can put on this sentence and you can guess. Read and guess. If you don't read, if you read, you'll read everything. You don't have time to guess. So don't guess. Is problem. So only read the problem where it is and guess it. So instead of reading this sentence, seizure started 6 weeks ago. Don't read that one. But what you do, read this one, described by pediatricians as. You read and then guess. Instead of seizure started 6 weeks ago, reading that one, you guess here. Described by pediatrician as what? Mild, moderate, intense, regular, sharp, normal, regular. So what is he describing them as? Long, short, serious. Seizures. What type of seizures are they? What is he describing these seizures as? You have to understand that one. Okay. So here you can say mild, moderate, long, short. All these things you can write. Long time, maybe time. Long time, long time. Longer or shorter, or long or short, or mild, or moderate, moderate, or intense, or serious, or normal, or regular. Okay. So what type of seizures are they? What type of problems are they? Described by pediatrician as what? What did he describe them as? Recurring seizures, That means coming again and again, happening again and again, or tonic seizures, or clonic seizures. What are the other type of seizures? Anybody, doctors, tell me. Tonic, clonic, or what type of other seizures? Anything are there? You let me know. Okay. I'm not a medical expert, so I don't know everything. You can recall. So others also will get the knowledge. Oh, that is enough. White more headache. So begin with a dash on face. Begin with these seizures. When they happen, they start with something. So bend, or pull, or curve, or stretch on face. What is that? Beginning with what? Dash on face. Scorn or shark. Scorn or shock. Begin with a shock on the face. Okay? Or a twist on the face. Or bend on the face. I'm just giving you some ideas. That's all. You can imagine. Bend, curve. Okay? Or, paleness. Paleness. A shock. A twist. A bend. A paleness. A stretch. Anything it may be. I'm not writing everything. Okay. His mouth makes a dash movements. His mouth make a dash. His mouth makes dash movements. What movements? Beating movements, repeated movements, jerking movements, or bending movements, or grinding movements, or grinding, teeth grinding movements, maybe bending movements, or you know, moving movements, or rapid movements, makes rapid movements, or slow movements maybe. Okay, slow movements, or fast movements, or sudden movements, or grinding movements. Okay, grinding your teeth or something like that, or chewing movements. Anything may happen. Mouth can make any movements, na? Or yeah, beating movements. Okay, rapid movements, anything like that. I'm giving you only some. Many things may be there. So such words you have to think. Such words you have to think. Next one, limited recall of event. We know need lasting up to 2 minutes. No need. It's not going to help us. Why should we wait? Reports feeling dash during seizure. Reports feeling dash during seizure. Feeling. What type of feeling? Anxiety. Feeling anxious. Feeling worried. Feeling upset. Feeling tensed. Feeling concerned. What it is? Feeling what? Feeling pain, maybe. Feeling pressure, maybe. You feel something. Or um, feeling tensed, maybe. Feeling worried, maybe. Maybe anxious, maybe. So, feeling something. Is feeling something there. Right, next one. Often suffers from dash. Often suffers from dash. What post seizure? He suffers from what? Maybe dehydration. Dehydration. Maybe something else. What is that? Often suffers from what you can think. You can write down there. So often suffers from uh, trauma, maybe. Okay, traumatic situation, maybe, or suffers from what? Suffers from um, suffers from confusion, maybe. Okay, suffers from some reason, something he is facing, so suffers from, maybe he'll get a headache. Okay, he'll get a headache maybe, or maybe he'll fall down and he'll get injury and he'll get injuries, maybe suffers from injuries, maybe anything. When he gets seizure, he falls down, maybe he is injured and he suffers from injuries. Anything may happen. Okay, so like that you have to imagine, right? So this is the way how you can guess. Okay, you guess your own words. Right, next one. So 18 to 24. 18 to 24. So you should not read everything. Remember that. Only where there are blanks, those bullet points only you read, because you don't have much time to waste. Instead of wasting time on the unnecessary things, you can use that quality time by analyzing the words. By analyzing the words. Okay. Yeah. So now 18 to 22. 18 to 22. Dr. Farhan is there? Yeah, Dr. Farhan is there? Farhan. Yeah, Syed Farhan is there. Yeah, he's very obedient. Very good. Nice of you. Nice of you. Okay, you are saving 3 or 4 lectures. You are saving 3 or 4 lectures. At a stretch, you will learn everything. So from tomorrow, you need not come to me for anything related to listening. Only if you have doubts, you can come to me. So everything will be clear today. Very good. Stay back, no problem. If you have no time, then you can leave, no problem. Okay. The more you spend time today, that's better for you. Right. Then, yeah. So 18 to 24. 18 to 24. Now let us see 18 to 24. Now performing well academic. Okay, you go through that one for a minute. Afterwards, I'll explain. First, you should analyze, right? I'll prepare some tea. Okay, you prepare 1 minute. Water is boiling. Okay. So now let me tell you. Krishna is there. Krishna is there. Krishna is not there. Okay, no problem. So who are the guests? Afsha Salim, you are a guest today. You are given free demonstration today. You can attend. No problem. So you are my guest today. Be my guest. Barry Jacksons, be my guest. Jacqueline, guest. Krish, you can be my guest today. Nilani is regular student. Nishanti is regular student. Safuratu is regular student. Swapna is regular student. Syed Farhan is a regular student. He's a doctor. And Zuhasha is a guest. Okay, all of you can attend today. And if anybody is interested, I have 2 places. Jacqueline already requested me that she wanted to join. So I'm waiting whether she will go out of the session so that I will not give her admission. If she stays till the end of the session, I'll give her admission. Otherwise, I will not give her admission, I told her. So the second place will be there if she leaves the platform. Okay, anytime in the middle, before I leave. Okay, before I close the session, if she leaves, then another place will be left. Otherwise, only one place is there. So one place is reserved for Jacqueline. Okay, right. So only one place is remaining now. So if anybody is interested, you can contact me later. I'll see if you are attending till the end, then maybe I'll give you a chance. Otherwise, no. Right. So performing well academically. No need to read. No need to read. Okay, Krish is Krishna. Okay, you are coming from iPad. Okay, I thought you are not there. So fine, no problem. So here, yeah. Now, performing well academically, this is not needed. Don't read that one. Born 42, okay, born 42 weeks. This is not needed. No need to waste this time. Okay, then had viral infection, no need. Okay, next, that's it. Others no need. So others only you have to read. Is dash like maternal grandfather. So maternal grandfather. So maternal grandfather. So the name mother will come. Mother's side. Mother's side. Mother's father. Maternal may not come. Mother may come. Mother's grandfather. Maternal grandfather. Okay, mother's side. Mother's father. Mother's father. So the son's maternal grandfather. Okay, son's maternal grandfather. So that means mother's father. So when that person comes, name comes, or his relation comes, immediately be ready. He has some special quality. That quality he is also like that. Maybe he is a dash like maternal grandfather. Maybe blind, color blind. Maybe negative or positive. Okay, maybe he is right-handed or he is left-handed. Okay, or he has short sight, short-sightedness or long-sightedness or sight problems. Anything may be there. Okay, or here this is not regarding. This is not regarding sight here. This is the second one, right? Yeah. Then next one. Next one is you should understand what are the qualities a person is white like his father, or he is he has a is diabetic like his maternal grandfather, or um, is sharp or intelligent or hardworking like maternal grandfather, like that. Anything may be there. Okay, anything may be there. Next one is dash. So what is the quality? He is clever like grandfather, or he is left-handed or right-handed. Okay, or he is industrious, hardworking. He is tall like his grandfather. So some quality, name of some quality. Okay, name of some quality. Okay, yeah. So you have some quality here. What are those qualities? It may be clever. It may be colorblind. Maybe I'm just giving you some examples. Maybe short-sighted, or it may be left-handed, or some quality which grandfather has. He also has that quality. Okay. So if the word is difficult, then he will give the meaning also. Here the word is difficult. So he will give the meaning also. Remember that. Okay. He'll give the meaning also, like maternal grandfather. Right. Next one. Is dash. Okay. Recently diagnosed as. What is a diagnosed? He was recently diagnosed as. Not he was diagnosed with. He was diagnosed with means a medical. He was diagnosed with diabetes. He was diagnosed with pneumonia. He was diagnosed with migraine. Like that. With means a problem. But he was diagnosed as. He was diagnosed as diabetic. Like that one. Okay. The patient is diagnosed as. Okay. Not the medicine, not the condition. He was diagnosed as a diabetic, or he was diagnosed with diabetes. He was diagnosed, for example, I am diagnosed with diabetes, or I am diagnosed as a diabetic. I see. Diabetes is the condition, diabetic is the patient. So try to understand that one very carefully. Okay. So you have to be very careful when you are analyzing the words. So it may be diabetic, or epileptic, or partially blind. Okay. Diabetic or epileptic or blindness. He was diagnosed with blindness. He was diagnosed as blind. That means he is blind. Okay. He has blindness. He is blind, like that. Okay. You have to consider those things there. Yeah. Next. Received dash straight afterwards. After birth, emergency C-section. After birth, he received dash straight away. So maybe he received some vaccination, or maybe he received some medication, or he received some sort of a treatment or something. Okay. He received something there. What did he receive? That you have to see. Next, had mild dash. Had mild dash. Mild problem. What? Constipation maybe? Mild constipation maybe? Or maybe allergy? Mild something? Or mild anything else? Any condition? Mild constipation, mild allergy. Okay. Right. Let us stop there. Experienced a one-off dash. Okay. At 14 months, had a viral infection. Experienced a one-off, maybe episode. Okay. Episode of what? One-off means episode of what? Some condition. Okay. Some problem or some condition. Name of that condition. What is maybe some sort of epileptic stroke or allergy or something like that. What happened? What happened there exactly? That you have to analyze. Mother is of dash heritage. Mother is of dash heritage. Maybe European heritage, or Arabic heritage, or Indian heritage. Okay, Indian heritage, or some other African heritage. African means belongs to heritage. Okay, inheritance. Okay, heritage. What heritage? Okay, you can say, you can also say like um, what you can say, rural heritage, urban heritage means he is from the urban area, rural area. Okay, or nation, village heritage. So tribal heritage, tribes. Okay, so lot of different words may come there. So mostly it will be European or nationality mostly. Mother suffers from dash. What is the problem of the mother? Mother suffers from maybe COPD, or okay, uh, COPD or angina or some other problem. So mother suffers from some other problem like this. So this is the way how you are going to analyze the words in the 30 seconds. Very fast you have to analyze and keep mental mapping. So these are the words I'm explaining. This is the clue. This is the clue. Don't read unnecessarily the words which are not important. That's what I tell you. Okay. Then next, we are moving to the audio. We are moving to the audio now. And I'm going to play the audio and try to target 12 out of 12 as far as possible. If we get less, there is no problem. Okay. So target the best. Yeah. Right. I'm taking you to the book now. Yes. So 20. Yeah, here we are. Get ready. Full focus, attention, concentration, techniques, and strategies.
B. Part B. In this part of the test, you'll hear
Hello?
6 different extracts.
Did you hear the audio? Audio. Okay, fine.
In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a dentist talking to a trainee dental nurse. Now read the question.
Yes. Get ready. Target 12 out of 12.
One of your responsibilities is to maintain moisture control for the patient using a device called the oral evacuator, which sucks up excess moisture and debris from the oral cavity.
Okay.
Now, when you're evacuating in the front of the mouth, you may notice saliva building up further back. But you don't take the evacuator tip and put it straight down in the center of the throat because this can activate the gag reflex if you touch the soft
1
palate.
minute.
So use it in the corner.
Complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
So, Mr. Fitzgerald, I understand that Tony's 9 and his seizures started about 6 weeks ago.
Yeah, that's right. The pediatrician was worried because Tony was experiencing what he called episodes of confusion.
Huh?
That's why he recommended this neurological evaluation.
I see. So what happens when Tony has a seizure?
I suppose the first thing we notice is that he gets this kind of vacant look. We didn't understand what was happening at first, why it was that he didn't seem to answer our questions, but he's since told us that he can't. It's like he loses the power of speech altogether. I had a chat with his teachers to see if they'd spotted anything unusual, and they said they'd sometimes noticed the same kind of behavior at school too. Later, we noticed that his mouth moves. It's as if he was chewing something, but there's nothing there. I suppose all that goes on for about a minute or two, and then it takes about 5 minutes or so before he's back to his normal self.
And how is Tony after a seizure?
Well, one thing that struck me was that he hardly remembers anything about it at all. I found that very disconcerting at first. He's told us that he becomes frightened whilst the attacks are happening and that he feels exhausted after. In fact, he often needs to lie down for a bit and he might even nod off. He also complains about having really bad headaches, though that doesn't happen every time.
And how would you describe Tony's ability to cope with life in general, like at school, for example?
Well, Tony hasn't got any problems at school. He meets the expectations of his teachers, even if he doesn't exceed them. Just your average boy, until now, that is. But he is creative, especially with his writing. In fact, one thing that's slightly unusual about Tony is that he's ambidextrous. It runs in the family on my wife's side. Her father was too. His teachers say he often writes with both hands in the same session. I did have a word with his teachers a while back because I was concerned about his spelling. They sent him for tests, and we just had confirmation that he's mildly dyslexic. It's a relief, actually, because now he's getting the support he needs.
Yes, I see. And going back to when he was born, Has Tony had any health problems at all?
He arrived late, well past his due date, at over 2 weeks late, and the labour didn't go as planned. My wife was induced, and Tony seemed to react badly to the stuff she was receiving intravenously to bring on labour. In the end, he was born by cesarean because he was in distress. Then he had an infection and needed a course of antibiotics. They began that immediately, and he was on them for 5 days. They both had to stay in hospital because of it. But other than that, he breastfed well and was a happy baby, even if he did have a touch of jaundice. That soon disappeared without any need for further intervention.
I see. And there's been nothing of note since then.
Well, there is one thing. About a month after his first birthday, Tony came down with a bad virus. He had a high temperature, about 40 degrees. That brought on a febrile seizure. So scary. But it only lasted about 5 minutes, and then he seemed to be back to his normal self. That's the only one he's had.
Right. Is there anything in his family history I should be aware of?
Nothing of note, no. My wife's parents are Chinese, so Tony's learned both languages from when he was a baby. I don't know if that has a bearing on anything. His grandparents are all fit and well. In fact, relatives on both sides of the family seem to die of old age. Though maybe I should mention that my wife does get sciatica from time to time. She hasn't had it for ages, but when she does, she can be out of action for weeks.
Okay. Well, thank you for filling me in on.
That is the end of part A. Now look at part B.
Yes.
Part B.
So now we are going to check your answers. Check your answers now. And write very neatly. A, B, C, D. Every letter should be perfect. Afterwards, don't cry if you fail in the OET reasoning, okay? I'm telling you, learn now itself and make it a habit to write neatly. Don't write for yourself. Don't think the other person will consider you. He will not even bother you. He will say, I care you a pin. He will not bother about you, and you cannot even question him. So don't take risk. Try to write very clearly. I will check your handwriting, and you should make sure that I will not have any complaint against your handwriting. That means you are excellent. You need not worry. You can be confident afterwards. So remember that, and that is how we are going to do now. Right. So here is the answers. Here is the, yeah. Right. So episodes of confusion. First one is, they describe the seizures as episodes of confusion. The full word should be there, all the 3 words. Next, A, is there or not there? No problem. Vacant look must be there. The next one, headaches, enough. Really bad is not there, also no problem. Really bad is not there, also no problem. Next, mildly is not there, no problem. Dyslexic. Be careful of the spelling. Ambidextrous, dyslexic. Be careful of the spelling. A course of is not there, no problem. Okay. Otherwise, everything is correct. And C, Chinese, name of a nationality. Chinese, people of the country China. So C, capital letter. Otherwise, nowhere else capital letters. If you write capital letters, you will lose your mark. So if you have written any capital letter, cut off your mark. Yeah. Come on. Come on, write and send me. Pen correction with pen. Correction with pen, not pencil.
Yes. Yeah, tell me, please. Yeah, send me the papers. Yes, I have got a Syed Farhan. Very good, Syed Farhan. You are getting 10 out of 12. Wow, your handwriting is very excellent. Okay, your handwriting is very excellent. Today's we are doing on paper, but next time onwards, do it on the original hard copy of the question paper only. Don't do in another paper, so that you will know how to write in that word blank. Episodes of confusion, right? Vacant look, right? Chewing, right? Frightened, right? Headaches, right? Ambidextrous, right? Mildly dyslexia. Wow, wonderful. You can get 450 if you do like this. First day itself, you are getting like this, means definitely you can get 450. No doubt. Target 450 plus. If you get 500 out of 500, I'll give you a gift. If you get 400 out of 500, you should give me a gift. Okay. We are not supposed to get less than 450. Remember that. Chinese is a problem, my dear. Chinese is a problem. You should write capital letter. Okay. Yeah, I'll show you there. What is wrong there? I'll show you. Okay. Yeah. All of you send your papers, please. Yeah, you can't hear me. You can't hear me now. Can you hear? Can you hear now? Me. Now, okay. Some problem with the computer, I think. Can you hear me now? Yeah. Yes. So here, now let us see here. Episodes of confusion like this. See, I told this doctor you have to write very neatly. I made him write handwriting. His handwriting was not very good yesterday before admission. Before I gave admission, I told him improve your handwriting. Then afterwards, I gave him admission. Okay. Now his handwriting is very clear, awesome. But you can improve still. Okay. vacant look. A and N is joined. You can't hear still. Why you can't hear, Jacqueline?
Okay. So maybe your network is problem, maybe. Okay. So so chewing, frightened, headaches, ambidextrous, mildly dyslexic, intravenous line. Okay, this is wrong. Infection, and should be very clear. Febrile seizure. Chinese, C capital letter. C is capital letter. C is capital letter. So wrong. This is wrong. You lost 1 mark here. Because names of countries and names of populations, you have to put capital letter. You lost this mark, okay? That's definite. Definite. So next time be careful. Whenever any country name, you are not supposed to. 10 marks is not a joke. Many people are crying for 10 marks. Okay. Be careful. Okay. So that's it. Sciatica. So now you are perfect in part A. Okay. I have no problem in part A for you. So in the same way, others also do them. Yeah. Unmute. I am going to unmute. Who is this? Syed Farhan. You can unmute now. Farhan. Unmute.
Yes, sir.
Yeah, Dr. Syed Farhan Ahmed. Oh, very
Yes,
big.
sir.
My God. Huh?
Yes, sir. Yes, sir.
Okay. Now tell me, are you confident with Partia now?
Yes, sir. Yes, sir.
From tomorrow onwards, you don't need to attend any of my parties. Okay.
Okay, sir. Okay.
So next I'm going to take part B now after this
Okay.
correction. If you are interested,
Okay.
you can be there. Otherwise, you can see some other day. So I'm clearing for those who are available now. Maybe for you, for Nilani, and for Nishanti. For these 3 people. Okay. I'm giving the full session. Whoever is there, even if 1 person is there, I'll give. Nilani, Nishanti are not there also, I'll give you. You are not there also, I'll give them. Whatever it is there, I will give all the session, complete test I will give you, so that you will, tomorrow onwards, you need not think of anything regarding writing. Only if you have doubts, you have to come to me. Is that clear, Dr.
Okay.
Syed?
Yes, sir. Yes, sir. Yes.
Yeah. So you will do it very easily. Now finished, part A finished. That means 60% finished.
Okay, sir.
60% finished because 24 questions. Now
Yes, sir.
only how many questions are there? 6 3s are 18.
Yes, sir.
So 60% is over.
Yes, sir.
So 18 questions only remaining. So more than 18, that is 24 questions over. So
Yes,
that's
sir.
it. So be ready. Now, if you
Yes.
want to have a little break, you can have. Otherwise, you can continue like that. No problem. Okay. Next, who else is there? Lily. Yeah, very good, Lily. I was sending links every time. You are missing. Okay, no problem. We'll get perfected. Very good, Lily. Thank you. I want to. Nilani is here. Nishanti is here. Very good. I thought they said they will go, but they are still here. Very good. How come? How come you are still here? Okay, if you attend this session, you need not attend any session afterwards. So attend full session, whatever it is there. I'm happy. So all the 3 are there and others also are there. Ashwini is there. Wow. Okay, Jacqueline is there. Yeah, Jacqueline is there. Yeah, session is done. Session is done. Okay, I can give you admission. Okay, I can give you admission. Send a message to me personally. Okay, I need your admission, sir. I have only one more. Jacqueline has taken the admission. Confirmed. So if anybody is interested, only one more place is remaining. So you can ask for me. Yeah, Jacqueline, you can send admission granted. Admission granted. Yeah. Let me see your question here also. Yeah, your writing is improved. So I can definitely give you the placement. So share. Yeah. You're obedient also. So I'll give you the placement. Yes. So when I am correcting, you people will know. One more last place is there remaining. Okay. Yeah, this is yes, what's the name? Jacqueline. Yeah. Right. Episodes of confusion, right? Very good handwriting. Vacant look, chewing, frightened, headache. No, headaches. How can you write headache, my dear? You should understand read the line there. If you read the line, it will be very easy to understand that you are wrong. I'll show you. I'll show you why you are wrong. Wait. Okay. You're crazy. How you lose this mark? Oh my God. Yeah, see here. Now, often suffers from. Often suffers from. Who is this? Location, local type, department, phone, email. Sign in to see this profile. Safuratu in a Zoom meeting. Okay, I know. Okay, so often means not one time. See the word, you have written wrong. You got the answer. But you lost the mark. That is the sadness. Now let me show you why you lost. If you think like this, it will be easy for you. Now here, often. What is that? Often. Question number 17, right? 17. Often suffers from. So, you wrote headache. Only one headache all these times, many times, one headache? Huh? Jacqueline, unmute. Unmute, Jacqueline. Open your mic. I think you need unmute. Why you are not able to unmute? Are you busy? Jacqueline, unmute. Yeah. You can unmute. I think you unmuted, but by mistake again you got locked. Yes, Jacqueline. So, okay, fine. She has some trouble, I think. Yeah. So, yeah, Jacqueline, what happened again? What's happening with you? Yeah. Again, she totally went out of the room. Okay. Yeah, some problem with her. Okay, fine, no problem. Let's move forward. So here, often means multiple times. Yeah, unmute. You can unmute now. Very important word. Many people, all of you learn this point. Jacqueline, unmute. Yeah, she is going to join our team now. I appreciated her attention. She is not running away from the class. She is ready to listen to the session. You need to be like that to attend my sessions. Yeah, fine. Again, some problem with her mic. Okay, leave that. So often means many times, multiple times, more than one time. Okay, more than one time, multiple times, many times. So that is not one time. One time means headache. Many times, na? So she gets frequent headaches. Often she gets headaches, not headache. Headache means same headache again and again she is getting. No, that was a different headache. This is a different headache. Number of times she is getting. So they are headaches, not headache. So that often is telling you that it is more than one. So you cannot write headache. You cannot write headache. It is headaches. So that is how. Then next one. Adventurous, ambidextrous. Okay. Ambidextrous means you can write with both the hands. Sometimes with this hand, sometimes with this hand. Ambidextrous. The next one. Dyslexic. Okay, spelling mistakes. Yeah, one letter gone, you gone. Okay, headaches. Yes, missed. You lost mark. Jaundice, right? Antibiotics, right? Seizure. S looks like capital. Chinese is wrong. C should be capital letter, my dear. C should be capital letter. Okay. You have written small letter. It should be capital letter. Okay. It should be the height of H. Capital letter. That's a mistake. So that is also wrong. You cannot get that mark. Sciatica, spelling mistake. You will not get that mark. Like the Chinese also, you will not get that mark. Okay. Like Dr. Farhan, he also wrote small letter Chinese. No. All are not small. Some letters you have to write capital letters like Chinese, Indian, Japanese, American, like that. Capital letters. COPD, capital letters, like that. If you write chronic obstructive pulmonary disease, then you have to write small letters. But if you write COPD letters, then you have to write capital letters. That is how it is. Very good. Yeah. So that is done. So others also. Now we are moving to part B. So I think you understood my evaluation. So you can evaluate like that on that same grounds. Now we are going to part B. What? Please unmute. Jacqueline, I am trying to unmute, but you are not able to get unmuted, right? Okay. Yeah, I am unmuting. Jacqueline, where is Jacqueline here? Not there. Okay, she left again maybe. Yeah. Okay. Right. iPhone. Who is this iPhone? Rename. Who is this iPhone? Is this Jacqueline? I think so. Yeah, unmute. iPhone, unmute. Is this Jacqueline?
Yes, that's me.
Yeah, Jacqueline, that's you. Okay. Are you happy with my explanation? I'm very
Yes,
serious mistakes. Are you happy?
yes.
If you are unhappy, I don't mind. That's not
I'm
my.
okay. I'm okay with your explanations.
You want to study with me? You see how I'm shouting. Even the doctors, I'm shouting. Are you ready?
Oh, yeah, I'm ready. I'm ready
Then
to.
only you can join. Otherwise, no. I admission granted to you. I saw. Actually, now admission one session is closed because second half is second half is another session. Part B and part C is another session. So your full session you are there. Very good. And you are even beyond. So I'm granting you admission. Regarding other things, I'll talk later. No problem. Okay. Other things
Okay.
we'll talk later. So fine. You wanted to say something?
I'm all right. As you said, we can talk later, so I'll talk
Yes.
with when you finish the class.
You good. We have two places. One place you got. Right.
Okay.
Only remaining one place I'll give to somebody else if anybody asks. Otherwise, no problem. Right. Now coming to the point, you can mute back. We are going to part B now. We are going to part B now. Yeah. So part B. Part B. Okay. Part B of what? Part B. Yeah, 6 questions. So part B, 6 questions. Yeah. Part B, 6 questions we are going to do now. Yeah, first question. Yes. Here it is, the first question. Okay. So now it is 1 o'clock. I don't know what time it is there for you. Give me your voting. Okay, give me your voting, all of you. Voting. Shall we continue or continue after the break? Okay. Shall we continue or continue after the break? Yeah. So you want to have lunch or breakfast or dinner or whatever it is according to your timing, or you want to have a cup of tea or anything. So what do you want to do? You want to continue or break? What do you want? A is go on, continue. A means go on, continue. B means break for 30 minutes so that you can refresh. What do you want to say? All of you, come on, because continue means I'll also go somewhere. Then afterwards, that speed, that momentum will be difficult again. So if you say continue, mainly I am trying to wait for Nilani and Nishanti. What about it? Are you comfortable? You are on duty or I don't know what it is. Continue means continue, non-stop nonsense. If we continue, then afterwards we can do reading also. Another reading, no problem. In the after break, after lunch, we'll have reading. Another session. So those who are really serious will join. And reading session is only for the regular students, not for general students. Okay, they will not be entertained. Only regular students, because I have to explain them carefully. Okay. So today I gave the demonstration session. Okay. Right. Tomorrow they can come, but not for reading. Right. Okay. How many of you are saying, oh, everyone is saying continue. Okay. Nishanti, Nilani, iPhone, Berry, Swapna, and Farhan. Okay. Right. We are going ahead. We are going ahead. Yes. Here is the first question. Okay. Here is the first question. Yeah, attend reading tomorrow. No problem. No problem. That's not a problem at all. Okay. Yeah. No, now I don't know whether I'm taking reading or not in the first place. My mood, it depends on my mood. Okay. As of now, maybe no. Maybe afterwards, maybe I decide. So function print screen. Yes. Rectangle. Yeah. Here is the text. So this is the text. Fine. Question number 25. Okay. One by one we'll see because this will be one by one only. So question number 25. Lily, very good. Thank you very much. You are attending. I was trying to send the link every day. I'm very happy to see you. Okay. So 25. You said listening was easy and so don't want to focus that much you told. So that's why I gave you time. No problem. So now 25. 25. Read this question. Think about this question. Then afterwards I will analyze. You analyze first. Then I will analyze. Then we'll play the audio and then we'll answer. Yeah, Nilani, your handwriting is awesome now. Awesome. Episodes of confusion, chewing, frightened, headaches, dyslexic, antibiotics, jaundice, febrile seizure, shiny spelling mistake, sciatica. Okay, your handwriting is awesome. And next, Swapna Godugu. Yeah, your handwriting is also excellent. Now, when I shout at you, you will listen to me. Otherwise, you'll not listen. I know, no? Episodes of confusion, vacant look, chewing, headaches, ambidextrous, X is not very well. Antibiotics, jaundice, febrile seizure, F is not very perfect. Chinese, right. Sciatica, right. Very good. Then next one, Syed Farhan. Can I attend a reading tomorrow? Okay, no problem. No problem. Yeah, think about this question. I'll get my tea. I forgot. Yes. So now let us analyze this question. You hear a dentist. So the person, the specialist is a dentist. The problem is with the teeth. Talking to a trainee dental nurse. So a doctor is talking to a trainee nurse. Okay. A dental doctor or a dentist is talking to a trainee dental nurse or a dental nurse. Okay, fine. Under training. So he is talking to her. He is talking to her, not the trainee dental nurse is not talking to the dentist. The dentist is talking. That means the person, the other person is listening to the dentist. If the dentist is a lady, and the nurse is a gentleman. Normally it will be like that. So he is explaining something. He is explaining something. He is explaining something. Okay. Sorry. He's explaining something. He is explaining something. Now, what to do in the event of an accidental injury to the patient? So, accidental injury. So, he's talking about an injury. He's talking about an injury and he's talking about a patient. Okay. He's talking about an injury and he's talking about a patient. Remember that, injury and patient. So, it is regarding a patient's injury or just injury to a patient only. Okay. So, most important word is injury. The need to put patients at ease before a procedure. So procedure is important here. So focus on procedure. The proper positioning of a piece of equipment. Equipment is the point here. So is he explaining regarding an injury? And is he explaining regarding a procedure? Or is he explaining regarding an equipment? What is he talking about? He may be talking about all the three also. Injury, procedure, etc. But what is he actually explaining? He may be mentioning everything, but he will be explaining particular one thing. Okay. So, injury or procedure or equipment. Equipment is an inanimate thing, a machine or machinery. Procedure is what the doctor will do. Injury is what happens to the patient. So first one is related to a patient, second one is related to the doctor, third one is related to the machine. So patient or doctor or machine. So you have to read between the lines like this. If you read between the lines like this, then you can understand it very easily. So is the point, is what he is talking, okay, is it about an injury, more focusing on injury? Or is he more focusing on a procedure? Or is he focusing more on a particular equipment? What exactly he is talking about? Majority. What is the central theme here? Explanation regarding an injury, or explanation regarding a procedure, or explanation regarding the equipment. Everything is explanation only. Okay? Right? Everything what they have to do only. But is it related to the injury, or related to the procedure, or related to the equipment? Okay? Injury is what happened in the past. Procedure is what happens in the future. Equipment is what it is now. Okay? So think about that one. Many things are there here. Past, present, and future. Okay? Right. Now clear. Now let us see. No need to listen to all the 6 questions. 1 or 2 questions enough. Okay, part A, very fast. So that's why I gave everything. Here, 1 or 2 questions in part A, 1 or 2 questions in part C. Enough. The same style, it will go, everything. Okay? Right. I'm just teaching you how the style is. That's it. Okay. Now let us see. I'm playing the audio. If you want me to explain everything, I will explain afterwards. No problem. I'm ready for that. I'm not an escapist. You know that. On your request, I'll do more.
This part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a dentist talking to a trainee dental nurse. Now read the question.
Your responsibilities is to maintain moisture control for the patient using a device called the oral evacuator, which sucks up excess moisture and debris from the oral cavity.
Okay.
Now, when you're evacuating in the front of the mouth, you may notice saliva building up further back. But you don't take the evacuator tip and put it straight down in the center of the throat because this can activate the gag reflex if you touch the soft palate. So use it in the corners, and you don't want to press against the soft tissue of the cheek either. That can cause injury.
Right.
You should also pay attention to the patient's body language. If you see any signs of anxiety in the eyes or in the hands, you may want to ask if everything's all right.
Mm-hmm.
It's a way of alerting the dentist, too.
So submit your answer now.
Question 26. You hear two nurses in a GP surgery.
Submit your answer now. Yes, submit your answer now. Yes. So only 3 or 4 students have given the answer. What about the others? Yeah, 5, 6, 7. Okay, right. So now let us check the answer here. Okay. $25. Answer is C. Why C is correct? You can notice there. Yeah. Yes, you can see there why C is correct. Okay. Yes. Because he is telling how to insert that one at that particular part. Okay. He's explaining how to use a particular device. Okay. He's telling don't put it straight down the center. Don't press against the soft. Okay. And he's telling use it in the corners, positioning. You can see that. Okay. C is the answer. C is the answer. You have to understand that one very clearly. Okay. So Syed Irfan, then Nilani, then Lily, then iPhone, Jacqueline. You have got the correct answer. Okay. Right? So you have to understand that one very clearly. Right? He's telling very clearly. Okay. He's telling the nurse how to use it, a particular device. He says, don't put it straight down. Put it. It means that equipment. Down the center of the throat. Don't press against the soft tissue of the cheek. Both are incorrect positions. And the proper position is use it in the corners. This is the proper position. So the other two positions, don't are improper positions. And the last one is the proper position. Use it in the corner. So that's why it is. So that is why this is right. Fine. Next. So 26. We are going to question number 26. Yeah, 26. Get ready. Think about this. Think logically. You hear two nurses in the GP surgery discussing a case of chickenpox. So two nurses, both are nurses. Okay. What are they both concerned about? Both. One may be concerned about one thing, another may be concerned about anything, but both are concerned about one thing. Try to understand that. Both should be concerned about that. Yeah, I agree, they have to say. Somebody should say, I believe that, yeah, I agree. That's not a problem. But then when they said second problem, yeah, I agree with that. So that is the concern. That is the concern. So you hear two nurses in the GP surgery discussing a case of chickenpox. You know, this is a chickenpox. Chickenpox. In the GP surgery, there may be many other patients. Okay. What are they both concerned about here? The possibility of contagion amongst other patients. So the possibility of contagion among other patients. Okay. This is about patients, other patients. The risks to members of the patient's family. So this is family members. Okay. This is family members. The severity of the patient's condition. Now you can understand here, are they discussing about more? Are they discussing about the patient? Or are they discussing about the family problem? Or are they discussing about other patients? So individual is patient, family is family, outside family is others. Now you have to focus in this angle. Okay. You are supposed to focus like this. You have to think like this. Then only you can get an idea. Okay. Are they talking about the problem to the patient? Or are they talking about the risk to the other family members, not the patient? Family members. Maybe father, maybe mother, they will get this problem. Or they're not bothered about the family, they're bothered about the other patients in the clinic. Okay. Patients, they already have a problem. Maybe they already got the problem also. They already contagious. They got maybe or may not, we don't know. But the patients, so is it only the patient? Or is it the patient's family? Or is it the other members in the hospital? Try to understand here. Individual or family or other patients. This is the angle you have to see. Possibility of contagion amongst other patients. So it may go to other patients. Then that will be a big problem. It may go to the parents. That will definitely be a problem, but that is not the hospital problem. Family, they get disease, that there is not a problem, but not their problem. It is the family's problem. But if other patients get the disease, then it is the hospital's problem. Why did you allow such patients into a middle of us? You are the reason. Because of you, we got this disease now, chicken pox. They will tell. So there will be a big problem. Or severity of the patient's. What are they talking? Are they worried about the patient or the patient's family or the other patients in the hospital? Think like that. How you have to? This is called a trident. 3 arrows going from one main javelin, 3 arrows, Shiva's trident we call. 3, like a fork. Fork has 4. Fork has 4. But here trident has 3. So 3 are there here, 3 options. A or B or C. So chicken pox, problem to the patient. So chicken pox, this is the chicken pox handle. Chicken pox is the handle. Now 3, is it the patient? Are they worried about the patient? Are they worried about the members of the family? Are they worried about the other patients in the hospital? So you have to think like that. Answer is already understood, more than half. Okay. Now listen to the audio. That's all. If you realize like this, you will understand 75% of the answer. You have to apply that logic.
Discussing a case of chickenpox. Now read the question.
Did you see Mr. Henson and his baby when he brought her into the clinic? She was absolutely covered in a rash.
Yeah, it did look bad, I suppose. You can understand why he and his wife were so worried when they first noticed it. But it was just a classic case of chickenpox.
Those blister-like spots confirmed it. He's had the illness himself, but as an infant, so I guess he didn't recognize it. Let's hope nobody else in the waiting rooms picked it up.
Well, it'd certainly be worth keeping her away from other people for a bit. I don't like the idea of people coming into the clinic getting infected. Anyway, hopefully his wife won't go down with it, or there could be problems looking after the baby.
Oh, she's already had it. He did volunteer that information.
Yes, now submit your answer.
Question 27. You hear an anesthetist talking to a patient. Now read the question.
Yeah, submit the answer, please. Submit the answer. Second answer, B, 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 B. Too many B's. Very good. That means about the family. Okay. Okay, fine. So I'm going to show you in a different style now, because it's not easy for you to understand in normal setting. So I'm trying to give you in a different setting. Yeah. I brought both of them for you. Did you see Mr. Henson and his baby? When he brought her into the clinic, she was absolutely covered in rash. That's already there. Okay. That's already there. Right. Now, yeah, it looked bad, I suppose. You can understand why he and his wife were so worried when they first noticed it, but it was just a classic case of chicken pox. Those blister-like spots confirmed it. He's had the illness himself. Okay. He's had the illness himself. But as an infant, so I guess he did not recognize it. Let's hope nobody else in the waiting rooms picked it up. See here. Let's hope. They're hoping that nobody else in the waiting rooms picked it up. They don't want anyone else to have it. Chickenpox. Anyone else in them. Because you know here, well, it would certainly be worth keeping her away from other people. So other people, well, it would certainly be, so she's confirming here. It is certainly be worth keeping her, worth. So keep her away from other people. Keep her away from other people for a bit. I don't like the idea of people coming into the clinic. People coming into the clinic and getting infected. I don't like people who come into the clinic get affected. So it is everywhere they are talking about the people who come to the clinic, the people who come to the clinic, the people who are in the waiting room, the people who are in the reception, everyone. Okay, everyone. So now let us see. Who are the other people? The other people who are in the other patients. Other people. Other patients. People who are coming into the clinic are other people. Other patients. Not the family. Not the family. Okay? Not the family. And let's hope nobody else in the waiting room. Nobody else in the waiting room. Nobody else is other people in the waiting room. Try to understand this one here. So 3 times he has given the answer and he's talking about the other people, other people, other people. They may get, they may get, they may get, they should not get. I'm worried. I'm worried. I don't like other people getting this. Okay? I hope others will not get it. All these things are pointing it out. So you can understand very, very clearly that the point. Okay. So have you got it clear? If you have understood, send me a message. Yes, sir. So we can move to the next question. So everywhere it is telling. So first one, the female is telling, and then the other one also is telling. Male. Okay. They are first female told, then the male told. Yeah, I agree. That certainly be, well, yeah, you are saying right. I also don't like. First one is telling, I hope nobody else in the waiting room picks it up. And second one is, yeah, I agree. So that's it. Yeah, come on. We are going to the third question. We're going to the third question now. Yes. Yeah, next. 27. Now let us see the answer. 26. 26 is the answer here. You can go through this explanation. Option A is the correct answer because you're listening for what they were both concerned about. The female nurse says, let's hope nobody else in the waiting rooms picked it up. And the male nurse confirms and says, I don't like the idea of people coming into the clinic getting affected. So they are both concerned about the same thing. That's it. Okay. Now, if you see parents will get the disease. They already got the disease. They already got the disease. Both the parents have already had it. And no other family members are there. Only father and mother are there. And both of them got it already. Okay. All right. You can see that very clearly there. They aren't concerned about her catching the chicken pox because the patient's mother. Okay. Right. Yes. Option B isn't the correct answer because both nurses talking about the man's wife, the patient's mother. Okay. As both parents have already had it. That's it. So next option C. Already she is in a classic case. So what is there more to be worried? They already know everything. Okay, it's confirmed. There is no question of worry. It's already confirmed. It's a classic case, classic example. So there is no need to be any other concern because they have no confirmed. There is no concern for the child because she's already got it. Yeah. Next, we'll go to the next question, 27. So 27 is here. Yeah. Yes. That's it. 27th question. Try to analyze this question, please. Yeah, when it is needed, I will explain. So one more last place. Is there anybody is interested? You can tell me. Because tomorrow onwards for only the regular students. No. 3 sessions. Yeah, study this question. You hear an anesthetic talking to a patient. You hear an anesthetist talking to a patient. So anesthetist and a patient. What is she doing? What is she doing? Doing something. So what is she doing? Is she explaining something? Or is she confirming something? Or is she advising something? Is it an explanation of what he does not know? Is it a confirmation of what he knows? Is it an advice what he has to know? So that's it. He must stop his regular medication before surgery. Stop his regular medication. Stop his medical regulation. Okay. Is she talking about medication? A previous adverse reaction he experienced. Previous experience. So past. Okay. Advising him discuss his concerns with the surgeon. So what is important here? Is it a problem with his medication, so he has to stop? Or is it another reaction in the past? Or is it discuss his concerns in the future? Now, is it present, past, or future? Again, why he must stop his regular medication before surgery? This is present. Presently, future he is going to take a surgery, undergo a surgery. So now he should stop his medication. Okay, that is in the present action. Confirming a previous action, previous adverse reaction he experienced. So previous action. Previous action. He knows about the previous adverse. Okay, previous means past. Previous experience. Okay, negative experience. So previous experience, that is past experience, past. Then the next one, advising him discuss his concerns with the surgeon in the future. So surgeon, the need of a surgeon in future, the need of stopping the medication in the present, the knowledge confirmation about the experience in the past, or the need to talk with the surgeon in the future. So I hope you understood what I am telling now. So medication, we have to stop now because you are going to have a surgery. So it will affect it. Or you had an experience in the past that was a bitter experience, a negative experience, adverse experience. So yeah, that was right. You experienced it. That is what you are telling is true. So she is confirming, the doctor, the anesthetist is confirming. Advising him to discuss his concerns with the surgeon. So you have concerns, I cannot help you. So you have to talk to the doctor in the future. Okay, maybe today or tomorrow or afterwards. You have to talk before the surgery. So that's what it is. So the problem with medication, or the problem with the past experience, or the problem with his concerns, okay, which nobody else is able to explain except the surgeon. So like that. So in this way, you have to think medication or reaction or surgeon. Medication, reaction, surgeon. Medication, reaction, surgeon. Medications which will make problem for surgery, so you should not take medications. Or earlier reaction was a problem, so that will definitely make a problem now. Or you have some concerns, I cannot help you, so talk to the doctor, surgeon. That's what she's telling. Yes. Now get ready. Here, surgery or why? Remember. Yeah, I'm playing the audio.
So Clark, I believe the surgeon's already had a word with you regarding the operation and he's outlined the main issues. If necessary, he can go into more detail with you.
I think I'm pretty clear on things now, thanks.
Okay. I understand that you've provided a list of medication that you're currently taking, and you know you shouldn't take them on the day of the operation. You seemed anxious about that.
Oh, I was just checking. It makes sense to me, actually.
Good. You had minor surgery last year and didn't respond well to the anesthetic, I believe.
A bit of nausea, yes, but it didn't last too long.
That's good. But it's still important to know because it affects the type of anesthetic we give you. We don't want you to have this same experience again.
Question 28.
Yeah, now write the answer, please.
Telling a practice nurse about
We don't want you to have this same experience.
Yeah, write your answer, please. Yeah. So first he said, yeah, he cleared everything to me. So C is ruled out. C is ruled out. He advised everything. Do you want any concerns? You can talk to him. No, he cleared everything, he told. So C is ruled out. Like that, you have to study. So 25, 26, 27. 27th is B. B is the right answer. B is the right answer. So A is not the correct answer because he already had this information. Okay. About the anesthetic and other things. Already knows about it. Okay. So she's confirming about the minor surgery last year. Okay. So that is 27. Now 28. Yes. Yeah. You can go through the question now. So we'll do one thing. We'll stop with B. Okay. We'll stop with B. We'll take a C later. So tomorrow I'll be explaining reading. Part A. So you hear a woman telling a practice nurse about her son. Right. You hear a woman telling a practice nurse about her son. Okay, what is she most concerned about? Most concerned about. Most concerned about. Remember that. The effects on her son's hearing. So hearing problem. The use of certain medicines problem. The prospects of surgery. So you have to focus in this one. Hearing or medicines or surgery. Hearing or medicines or surgery. What is she concerned about? So that you have to listen carefully. So if you listen like that, it will be easy for you.
It's again.
Question 28. You hear a woman telling a practice nurse about her son's ear condition. Now read the question.
So, how's little Ben been coping with his ear infections?
He's still having them regularly. They're really dragging him down. He's very pale these days and rather tired. I'm not sure if he's suffering from hearing loss, though, but it's hard to tell.
He does look pale. He's 3 now, isn't he?
That's right. He's had this problem for ages, and each time the infection flares up, it's clearly painful. But I think what he's been given really isn't doing him any good. His stomach's upset whenever he has a new lot of antibiotics. And I feel he needs another solution. You mentioned him having an operation. It's not without risks, I know, but I'd definitely be in favor if that would do the trick.
Well, I think Ben should see the doctor again. I agree this has gone on quite long enough.
Question 29.
Yeah. So submit your answer, please. Submit this answer, please. Yeah. Dr. Syed Farhan, unmute.
Yes, sir.
Can you share your experience? How beneficial is this session for you?
It was good, sir. Learned new things,
So
tricks.
you, on the first day itself, you got everything cleared, right? Regarding part A.
Yes, sir.
Part B also, right?
Yes, sir. Yes, sir.
So only part C is left, correct?
Yes.
We'll
Yes, sir.
see. We are going ahead. We'll see. Okay. Right.
Okay, sir.
So
Okay,
because
sir.
we need some gap also, I think. So I'll see if it should not affect our thinking power also. So
Yes, sir.
because
Yes.
part C will be very tough. So I have to
Okay.
explain more. Huh?
Okay, sir. Okay, sir.
So if you are already strained, maybe we cannot concentrate on that one, right?
Yes, sir. Yes, sir.
So that's why we'll take no problem, no hurry. Okay.
Okay.
Right.
Yes,
So
sir.
you
Yes,
tell
sir.
me, there is one student, Jacqueline, waiting for admission. Can you tell her what type of teacher I am and how my teaching style is? Would you recommend? You joined yesterday only. Would you
Yes,
mind?
sir.
Are you getting the quality which you prefer? What exactly is your opinion? Do you recommend this session for her? Yes or no? Why?
Yes,
How
sir.
you
I
have to
would
tell.
recommend, sir, that I'm getting my doubts cleared. I'm learning new tricks. Uh, so I think the session is beneficial. I would recommend this session, sir.
Yeah, fine. So that's it. Thank you very much. Now,
Thank you,
next,
sir.
here, let us see what is the question here. 28. What is the answer for this question? Number 28. 28 is B. 28 is B. Yeah, most of you have written B. Right, very good. Because she's telling whenever he takes some new medication, he has some stomach upset or something like that. Okay. And that is the main concern. That is the main concern. Okay. At the moment. Main concern. So I think what he has been given really isn't doing him any good. I feel he needs another solution. Okay. That's what he's telling. And she is telling, I am in favor of the operation, in favor of the surgery. So she is not concerned about the surgery, right? That's it. Okay. And she says he is not suffering from hearing loss. Okay. So I'm not sure. She's not sure about that. So how can she say? So that's it. Right. Next, 29th question. Twenty-ninth question. So part A will be difficult questions, part B will be more difficult questions, part C will be the most difficult questions. Okay. They will be difficult, more difficult than part B. Lot of thinking is needed and there will be confusion also. So we have to be little careful. Yeah. This is the question. Go through this question, please. Last but one question. There is one more question in part B. Yes. You hear an ear, nose, and throat consultant describing a recent cancer case he was involved in. Okay. So, ear, nose, throat consultant, recent cancer case he was involved in. The unusual thing, unusual means not usual, extraordinary thing, special thing, abnormal thing, okay, about the case was shrinkage of the tumor occurring relatively quickly. Okay, this is about shrinkage of the tumor. Then next one, bone erosion not showing up immediately on the scans. It is a bone erosion. This is tumor shrinkage. This is bone erosion. CSF leakage, cerebrospinal fluid, CSF leakage being detected so long after the first operation. So is he talking about shrinkage of the tumor, or is he talking about the erosion of the bone? Is he talking about the leakage of cerebrospinal fluid? Okay, that's what it is. You should understand cancer. So you try to understand this one. Is he talking about shrinkage of the tumor? That means tumor became less in size, less in size, less in size. Or bone erosion, bone is fading away, eroding. Or leaking, CSF, cerebrospinal fluid is leaking off. So what is important here? Leakage, erosion, or shrinkage? The main words are shrinkage. You have to think about the shrinking of the tumor or erosion of the bone or leakage. So focus on these things. Is it shrinkage of the tumor, erosion of the bone, or leakage of the CSF? So that means, is he talking about tumor, or is he talking about bone, or is he talking about the fluid? So think about that one. Anyway, you'll get the answer. Shrinkage, erosion, or leakage, or tumor, bone, or cerebrospinal fluid, whatever it is. So focus any one, you'll get the answer. But focus on one properly. I'm playing the audio now.
You hear an ear, nose, and throat ENT consultant describing a recent cancer case he was involved in. Now read the question.
So generally, we can say that the treatment on this patient was successful. However, one issue that did arise from this case was the events that made it necessary for us to operate on his nose twice. Now, with a tumor of this type, it's very common for bone erosion to occur. As the tumor shrinks, we often see some degree of CSF leakage, cerebral spinal fluid. We'd expect to see this soon after treatment of the tumor, but with this case, it occurred 13 months later. So we had to carry out a second operation to address the problem. What we've learned from this is that we need to take early bone imaging to see if there are any areas of bone thinning, and then adjust our method of treatment if necessary.
Yes, now submit your answer, please.
Question 30.
Submit your answer, please. Yeah. $29. Yes. $29. So there it is. Majority of you have written B. Check it out here. Option C is the correct answer because the consultant says we would expect to see this CSF leakage soon after treatment of the tumor. But with this case, it occurred 13 months later. So it occurred 13 months later. Option C is the correct answer. You can see there. we would expect to see this CFS leakage soon after the treatment of the tumor. Normally, the leakage will happen soon after the tumor. Treatment is done. But after treatment is done, after 13 months, this is unusual. Normally, what we expect is to see the CSF leakage immediately after the treatment. Okay. So see here, we would expect to see this CSF leakage soon after treatment of the tumor. That means immediately after, maybe within 15 days, 1 month maximum. The leakage may be there. But what happened in this case? With this case, it occurred 13 months later. Why so much delay? That was unusual. Delayed leakage was unusual. The leakage being detected so long after the first operation. See that? After 13 months. Okay. 13 months. The leakage was found out after 13 months. Try to understand this one. Normally, it happens soon afterwards. Immediately. Okay. We would expect this leakage immediately, but this delayed so long. After 13 months only, we notice this leakage. This is unusual case. In every case, it comes within 1 month or maybe maximum 1.5 months. But in this case, it took 13 months. This is not regular. Okay. In this case only, it happened like this. In other cases, we'll see immediately after the first operation. That's what he told. Is that clear? Is that clear? Yeah, let me know. Barry Jackson, I think you're also regular. So if you're interested, you can let me know. Only one more place is there. So today I'm closing the admissions. All others left because they are not serious. Yeah, Jacqueline is there still. Jacqueline is there. So that is what is the serious nature. Okay, if you're really suffering, you'll be staying and learning like this. Yeah. Next. Last question. The last question. Yes. Go through this. You hear a surgeon and an anesthetist briefing their team before an operation. You hear a surgeon and an anesthetist briefing their team before an operation. They point out that post-operative care may be complicated. Complication, post-operative care. After operation, post-operative care may be complicated by the patient's poor respiratory health. So respiration, previous surgical history, previous surgery, problems with blood clotting, problems with blood. So is this regarding respiration or is this regarding previous surgery or is this because of blood? So what is the problem? What is going to complicate? Is it a respiration, breathing problem? Or is it a surgical problem, earlier surgical problem? And now blood problem. Blood will clot. respiration will be difficult. Surgery will complicate the condition. So what is the problem here? Respiration is problem means breathing, or surgery, previous surgery, or blood will clot, blood. So respiration or breathing, surgery or operation, blood. So these three words, anything may be right. So focus on these three words and you will get the answer. Don't try to listen to everything.
You hear a surgeon and an anesthetist briefing their team before an operation. Now read the question.
The last case on our list is Jonathan. We're going to do a Kelly's procedure on him to rearrange the tissues of the pelvis. You might remember that he had his back done just a few weeks ago. He's had recurrent UTIs as well as respiratory infections. We have some concerns about his chest. His bloods are all normal, apart from his clotting, but he's got 2 units cross-matched just in case. Laura?
Thank you. It's quite a complex case, anesthetically speaking. He's very wheezy and at high risk of developing a significant post-op chest infection. That isn't going to make analgesia as straightforward as we'd like afterwards. He's going to need a chest x-ray. Oh, also because of his back surgery, he can't have an epidural, which we'd like to have done. We're definitely going to need a bed in intensive care. Perhaps we should call to confirm there's still one available.
Yeah.
That is the end of part B.
So that
Now
is the
look at
end of part
B.
B. Yes. Now write the answer. What is the right answer you think? $30. Yeah. Yes. 30 is A. He has had recurrent UTIs as well as respiratory infections. And the anesthetics say the patient is at high risk of developing a post-op chest function. Yeah. So that's it. Yes. Now, see, this is what it is. Yeah. So all of you, yeah, Barry Jackson, you are there till the end of the session. Okay. Very good. I like your seriousness. Yeah. So all of you share your message. How was the session? And the session part C will be there. Now it is 2 o'clock, 2:10. Part C, we can have at evening. So let me ask Dr. Farhan. Dr. Farhan, you give me your timing. Because others, they are used to, no problem. So because you are new, no? So you can tell me. Dr. Farhan, mute all. Okay, you can unmute and you can speak.
Sir, for part C, I feel, can I try myself?
Part
Can I
C,
try? Yeah.
you want to try yourself? Yeah, definitely you can try, no
Okay.
problem.
Yes, sir. Can I?
You can try, but I'm not asking about trying.
Yes, sir.
So I am going to take a session today. Part C also will complete.
Okay,
So
sir.
is it possible that you want to attend or you want to attend some other day? You are tired for today.
I'll attend some other day, sir.
Huh?
I'll attend some other day, sir.
Some other day. Fine, no problem. So then that case, then we'll delay the session. No problem. Okay. So no
Yes, sir.
worries. Then
Okay.
we'll go with something else. Yeah. So Barry Jackson, welcome to our platform. I really appreciated your attempt. You were there from the middle of the session. You joined, but you were there till the end. So I'm giving you an offer. You can join the session. Okay. You can message me on my WhatsApp. And here is my WhatsApp. I'm giving you my number. Yeah. Copy link. So all of you send a message. How the message is. Okay. How the session was. Just send a message in 1 or 2 sentences. Yeah. So that is, if you are interested, you can join the course. I'll give you a little bit of discount today if you join. Okay. If you come tomorrow or day after tomorrow, that discount will not be there. Because I have seen you today. You are very serious. You are there till the end. So I'll give you a chance. Only one last place is there. That's why. Yeah. Only one last place is there. That's why. Yes. So Farhan will do one writing session today. That's better, I think. Is that okay for you, Farhan? Instead of part C, we'll take writing.
Sir, after, I'll be busy, sir, afterwards. That's why I
Okay,
don't
no
think.
problem. Then carry on. We'll see tomorrow. Okay?
Okay, sir, sure. Thank you.
That's no problem. You carry on. You carry on.
Yeah.
Very
Okay.
good. No worries. Yeah. All of you send a message here in the chat box. And then Nilani. Hello, Nilani. Hello, Nilani.
Yes, sir.
Yeah, how
Yes,
was
sir.
the session? Did you understand?
Yes, sir. Yes, session is very, very good, sir.
Are you
It's very
happy?
clear. Yes, I am very happy.
Yeah. Okay, fine. You have introduced one friend, right?
Oh, yes, sir.
Very
My
good.
friend,
Thank
yes.
you very much for passing on the message. Okay. Because of you,
Okay.
another friend is able to learn. Okay. So if anybody, I'm trying to do a lot for you. I'm blessing you a lot. You asked, sir, I have 2 hours. So I arrange sessions for you. So like that. So you also can share your information with your friends, like how you shared with, what's her name? Nilani and Nishanti. Yeah. So like that, if anybody is interested, you can share with them. Okay. Right?
Yes, sir. Okay, sir.
Okay,
Thank you very
fine.
much, sir.
No problem. And part C, I'll be explaining maybe in the evening or something else. Okay, I'll discuss with you. When you are free, message me. I'll arrange sessions. Okay. Anytime you are free, you message me, but message me at least half an hour before. Don't say suddenly I am free now. Okay. At least half an hour before. Yeah. Barry Jackson, the guest. Yeah, you share your experience. Yeah, Syed Farhan, you can leave now. Yeah. Barry Jackson's. Yeah, Nilani, you can also leave.
Hello, sir.
Yeah, Barry Jackson, tell me about your experience.
All right. Thank you so much for these sessions. I must say that it's quite educative and then an eye-opener to some areas that had looked great thus far. So I must really appreciate your time and then your dedication to the tutoring. Well done, sir.
Yeah, thank you very,
Yeah.
very much. So you can attend whatever sessions today are there. You can attend because these are demo sessions for you. Okay, right. Then next, yeah, you can leave now. Then Jacqueline. So we'll confirm your admission now. Yeah, Barry, you can leave now. Thank you.